All right, welcome back. Sam Visnick here, Release Muscle Therapy. In today's video, we're going to be discussing the TFL muscle. If you're not familiar with the TFL, it is the tensor fascia lata. It is a small muscle located on the front of the hip. It is oftentimes associated with a number of different problems. Number one, in the hip region, because it is a hip flexor muscle. Number two, to the knee, as it has its important role in knee stabilization through the IT band, and of course some effects on the lower back. Because of its influence as a hip flexor, it can cause the pelvis to tilt forward, and that is going to increase the arch in the lower back, and if that is an issue, it can be a problem as well. So the primary function of the TFL is threefold. Number one, it flexes the hip. So in this position, for example, that would be lifting the leg straight up. So that is a contribution of the TFL. The TFL also abducts the hip. That's called abduction. That's lifting the leg out to the side. So if you're laying on your side and lifting your leg up in the air, the TFL will contribute to that. The last function is, because of the origin and insertion of the muscle, it will assist with rotating the leg inward. So when you combine these motions, it's kind of awkward to consider how that muscle works, but think about standing on your left leg, for example, and using your right TFL kicking a soccer ball. So you would be flexing and rotating your hip forward, but you're also kind of reaching with it. So it is kind of an odd mixture of movements. So the primary issue that we do find with the TFL oftentimes, and this is talked about in a lot of places online, is the overactivity of the TFL. So a muscle that is overactive is said to do too much work. It oftentimes fatigues, and it can distort or disrupt the normal mechanics of a joint or area. So the TFL is a great muscle. I don't know why it's so oftentimes looked down on as being problematic, because the TFL, like many other muscles that compensate, has an important role, especially with stabilization of these key areas. If you look up in the research, we'll oftentimes notice that the TFL muscle will become overactive and will grow, i.e. we call it hypertrophy, in particular when there is any kind of problem with the hip, and some in particular would be tendonitis or tendinopathy of the glute medius and the glute minimus. So what we're oftentimes looking at here is trying to reduce the role of the TFL in favor of some of those other muscles so we can improve the mechanics of the hip and the knee. So what I'm going to do is to show you some of the two of the most common compensatory mechanisms for the TFL. One of them is compensating for the hip rotating inward, taking load off of the glute medius, and also the leg lifting out to the side, that hip abduction, again, taking work off of the glute medius in favor of using more TFL, okay? So number one, I'm going to have Melissa here lay on her side facing the camera here. So the most common thing that we find is the hip abduction TFL role doing too much work. So if we bring the leg out to the side just like this, and the leg being in line with the body, just by raising the leg up to the sky, we're going to be using our glute medius, we're going to use some TFL. But the easiest way to see when the TFL is doing too much work is when the leg starts to creep forward of the body, and we're seeing an indentation or an increased angle here on the front of the hip, as we see the TFL try to assist with more hip abduction, okay? When we do the hip abduction with an emphasis on the glute medius, we want the leg to be in line with the body, but a nice little trick here to get more glute medius is to bring that leg slightly behind the midline. As we bring it behind the midline, we lengthen the TFL in the front. So its hip flexion activity is being reduced, and also as we're bringing the leg behind, we're lengthening it and reducing its mechanical leverage and improving the glute medius. So in this position, if you find it hard and that hip keeps dropping backward, I'm going to have her grab onto the table. She can push her pelvis forward a bit. So then in this case, she's laying on her left, turning the pelvis to the left, and bringing that leg up. We're going to feel more glute medius. So this is one way to improve the activity and reduce of the glute medius and reduce that TFL activity, okay? Now, the second role that we have an issue with here is the internal rotation of the hip. So in this position, if we keep the knees together and then lift the foot up in the air, this is internal hip rotation. Internal hip rotation is accomplished predominantly by two things, which is the TFL but also the very anterior fibers or the front fibers of the glute medius. Okay, so these two muscles are working together. It's not uncommon for people to feel a cramping or feel fatigue purely in the TFL muscle. And again, this can be improved just by different cueing or using some type of implement or bolster to assist with getting a little bit more glute medius activity, but I'm going to show you a simple way to get around this. What I do is I stick my arm here and ask Melissa to gently push her leg against my forearm. That is going to initiate hip extension. So remember, hip extension, like we did in the previous activity, is going to reduce TFL activity. If she gently keeps that pressure pushing against my forearm and then lifts the foot up into internal rotation, this is going to bias the anterior fibers of the glute medius. Now this motion can be accomplished very easily on your own by just gently pushing the foot into the wall or positioning yourself in a doorway to be able to push the thigh into the forearm, okay? And then relax. So these are the two motions that we're looking to reduce TFL activity in. I'm going to give you a couple of more movements here that I use if that TFL really just does not want to shut off. So we will actually take a tangent and do a couple of movements to inhibit it, and then come back and then recheck these two motions again to see if we can get less TFL activity. Okay, what we're going to want to do is to grab a rubber band or a glute band, what we would call it, and we're going to place it around both legs, and we're going to place it above the knees. I'm going to ask her to put her feet flat on the table. Okay, go up a little bit closer. Now we know that the TFL is a hip flexor and an internal rotator, so we're going to antagonize those two movements. So what I'm going to ask Melissa here to do is to lift her hips up in the air, doing basically a hip extension. Does that sound familiar? That's what we just did on previous drills. This is going to reduce the hip flexor activity of the TFL. Now, second of all, what we're going to do while the hip is in an extended position is to push the knees outward. So we have an extension and a knees outward motion, which is going to bias the glutes and the external hip rotators relative to the TFL. So yes, we are abducting the hip, but because the hip is extended in this position, it's very hard for the TFL to do any activity. So we can do two things here to improve the effect from this. We can do small hip extensions, just little glute pulses, just to encourage the hip extension function. Okay, and then stay there. And then we can also do small knee pulses, just pushing the knees outward to emphasize the glute medius. Now, normally what I find is about a minute, maybe up to 2 minutes of this, depending upon how much endurance you have, is enough to get the job done. Then we'll come down and get rid of the band. And usually by now you have a good pump in the glute muscles. Go ahead and lay on your side again. And then I would recheck the motions again. So we would extend the hip and then we would lift it up and to see if we feel a little bit more of the glute medius and less of that TFL. Usually that one correction along with a little bit of cueing really gets the job done. Now that will also surprisingly work with the internal rotation of the leg as well. Once we get the glutes and the glute medius kind of fired up and we inhibit that TFL, then we'll feel it a lot more on the backside. So this is my two favorite ways to reduce TFL overactivity. Certainly there are other ways to do it. I'll make a couple of videos if you're interested in doing self-releases with a tennis ball and so forth in the TFL, but I find this method I just showed you way faster. So if you want to see more information about the TFL, how to inhibit it, how to do additional things to get less TFL activation in your movement patterns, just comment down below. And of course, if you like this video, give me a thumbs up, comment, let me know what you want to see more of, subscribe to the channel. And then, of course, I'll see you next time for more information on addressing asymmetry and muscle balance. Thanks for watching.